Good afternoon, everyone, and welcome to the Community Development, House and General Government Committee meeting of the Winston-Salem City Council. Today, October 12th, 2021. Due to the pandemic, all committee members are participating virtually. For virtual meetings, committee members will be muted until asked to be heard. When there is a vote, it will be necessary to take a roll call vote. A committee member will be recognized, raise their hand, and state their vote. I see that the committee members are here. Councilmember Anna Scipio, Vice Chair, Councilmember Robert Clark, and Councilmember Kevin Monday, and yours truly, Councilmember Dee Dee Adams. City Clerk, we have the consent agenda. We have a consent agenda and a general agenda. And at this time, if there are any items from the consent agenda that you want to be pulled, committee and or council members, please voice your pulled item. I'm going to pull C2.
Madam Chairman, I'll make a motion on to approve the balance of the consent agenda.
Thank you. It has been moved and properly seconded by Councilmember Clark and Councilmember Scipio. Will the city clerk please call the roll?
Councilmember Scipio.
Yes.
Councilmember Mundy.
Aye.
Councilmember Clark.
Yes.
Mayor Pro Tem Adams.
Yes, and the motion passes. And will you please call the C2 item?
Item C2, information on community development services inquiry.
Ms. Tony.
Yes, good afternoon, Mayor Pro Tem Adams and members of the committee and council. I would like to recognize our Community Development Director, Ms. Marlon Newman, to review this item.
Thank you.
Good afternoon, Mayor Pro Tem Adams, members of the committee and members of the council. Again, Marlon Newman, Community Development Director. In front of you is an information item that outlines some steps that the department is trying to take to increase transparency and set some systems in place that will help all of us who are involved with managing information, primarily from our code enforcement efforts, as well as activities within our lending department, so that we can keep the community assistance liaisons, keep you, and ultimately members of the public informed about the level of engagement that our department has on those two particular areas. And so what we've outlined is 4 different steps that we're taking to try to increase our communication and transparency. First, a daily report will be run, and this is thanks to our information services department. We will run a daily report that outlines the level of activity that the code enforcement officers undertook in each ward on a daily basis. So every day, our CALs will get a report that shows all of the activity, from action orders to actual case numbers that were entered and touched on the previous day. And then on a monthly basis, we will be sending each of you a report that shows the level of activity in your respective wards, to also help you understand the level of engagement that our team has undertaken. In addition, we have a designated staff person, which is item number 3, who we are internally using as our liaison. And you see here, I refer to it as a clearinghouse, where that individual can field calls from your CALs and anyone else about specifics on either a code enforcement case or a lending matter. We figured to kind of centralize all of the inquiries with one individual who can serve as that point person. That might help to kind of streamline some of our communication efforts, because right now we have a variety of calls coming from a number of areas, and we have staff members who are sometimes having difficulty actually staying on task with some of their primary responsibilities because they're fielding calls from the public. So we thought we would try this process to see if that might streamline communication. And then finally, you'll see under item number 4, we will be partnering with CityLink on a quarterly basis and inviting the CALs to this quarterly gathering to really understand what challenges they may be having with using the mobile app, because we do have a new 311 system, of course. And so just wanting to make sure that all of the systems are working as they should. We're continuing to work out some kinks as we go along, and also to understand any other challenges that they may be having with communicating with us or getting the OneView system to work and things of that nature. And we thought it's also a good time if there are updates to the system, and certainly once the Community Development Department is able to transition over into Acela, which will be our new code enforcement software system, that'll take some learning and some getting accustomed to as well. So we thought that if we had quarterly work sessions, if you will, to all communicate and stay on the same page, that might also help us with our communication and our efficiencies. And so that's what we're rolling out. Actually, your CALs should have received their first report yesterday. And so again, we're going to be rolling this out real time, and you will get your first monthly report in about a day or so, which will cover the September activities. And so I'll pause there and entertain any questions you may have.
Thank you, Ms. Newman, and thank you, Ms. Tony, and your department for making this happen. Because as council members, we all know how difficult it can be and for our CALs to follow up on everything once they find an issue or get an email or phone call or text. They're juggling just as many balls as the people in community development and inspections. I think this process is much needed to help cut down on the duplicity of emails and calls. And there's some, which I like, is the transparency and accountability as to where the call or the issue came in at and who is responsible for making sure that it's resolved or are working on it, and can tell us how long it's been in the pipeline. Are there any questions or comments from the committee or the council?
I like the idea. Thank you.
Thank you, Councilmember Clark. Councilmember Mundy.
Yes, my question, thank you, Chairwoman Adams. So I appreciate that. My question is about CityLink. I know we've had problems with CityLink, and I'm still hearing from constituents and citizens who call me that they reported things to CityLink and it never went anywhere, or they're still not able to get in touch with CityLink. So I wonder if maybe our next meeting we could get an update on the CityLink progress and where we are with getting that up to speed and making sure that it is a trustworthy source for our citizens to go to.
Afternoon, Mayor Pro Tem Adams, other members of the committee and council. Councilmember Mundy, we will return to the committee with an information item on the progress that we have made. Yes, we're still recovering some of our earlier challenges, but the metrics indicate we are showing considerable improvement. So we will bring that information before the committee.
Thank you, Mr. Taylor.
Yes, sir.
Councilmember Larson.
Yes, I want to thank the staff for putting this together. This is a huge piece of work, and it's going to be a huge piece of work to follow through on it. But as one council member, I really appreciate having this information in my hand. It will help me monitor the projects that are in my ward and keep me up to date. And it's long overdue, and I thank you for this initiative.
Thank you. Any other comments or questions? Mr. Taylor, Ms. Tony, I know we're going to have the quarterly meetings with the CAL to discuss how the system's working and everything. Is there any, and maybe it is, I don't know, connectivity to the new systems and CityLink? I mean, we need to understand too as council members how that works. I mean, we don't make the calls into CityLinks. It's the citizens that use that app. And is there connection? Do they work together collaboratively, the systems, to report issues?
Good afternoon again. The cities do have the software programs connect. So information does go from one work group to the other. So what I will do is add a diagram of how the information flows when we bring the information item back, and we will also show you how that connectivity flows and the workflow as well.
Yeah, thank you, because I know, as Councilmember Larson said and Councilmember Mundy, a lot of us have gotten calls or emails from citizens that say they attempted to make a report and the system was not compliant to what they needed to happen. So there's also people that say they left the issue of the report and they never heard back from anyone. So I do think this is a good time for council and our assistants to work together, as well as staff, as to how we can shore this up as we move forward. So thank you so much. Looking forward to the next phase of this process. Moving on to the general agenda, City Clerk, would you please call the next item?
Item G1, resolution authorizing the city manager to implement the City of Winston-Salem approved COVID-19 vaccination policy.
Mr. Rao.
Good afternoon, Mayor Pro Tem Adams, members of the City Council. As we have seen over the last several months, the Delta variant of COVID-19 has contributed to a rise in positive cases and hospitalizations. The city manager a couple of months ago offered a paid time off incentive for employees to provide proof of full vaccination. We had a low response to that, and so flowing from that, city staff have prepared a draft vaccination policy that we would like to present to you this afternoon. I'd like to recognize Dr. Marcus Barnett, our Human Resources Director, who will present an overview of the policy.
Thank you, Mr. Rao. Good afternoon, Mayor Pro Tem Adams, members of the committee and members of the City Council. I'm here today to talk to you a little bit about the policy that Mr. Rao just mentioned. I think there is a presentation that's available, and Madam Clerk, do you have that presentation?
Yes, Mary Beth's going to be sharing her screen.
Thank you.
Thank you.
Okay. Can we go to the next slide? So the first thing I want to talk about today is why. Why are we traveling down this road? So since we have seen an increase in numbers from the Delta variant of the COVID-19 or the novel coronavirus, we have seen increased costs in terms of our healthcare. We have seen lost time from work, loss of accrued personal time for our employees, a definite impact on our operations, and an impact on our employees' physical and mental health. Our overall goal here is to increase workplace safety, and that means increasing workplace safety for our employees, but also for our customers, the citizens as they're coming in to see and receive the services that we offer as an organization. Slide. So a little bit about the incentive. In order to be eligible, it would be for all employees who provide proof of full vaccination status within a 6-week period from the effective date of the policy. And it would be a one-time lump sum payment. So for all full-time employees, that would be $1,000. For part-time employees, $1,000. And then for our full-time temporary employees, that would be $1,000. And then following the 6-week opportunity to qualify for the incentive, we would do $500 for full-time city employees and temps, and part-time city employees would be for $250, and that would be in that second 4-week period. Slide. So here's just kind of a breakdown of the cost. We are being optimistic, right? If all of our currently unvaccinated employees or the estimated unvaccinated employee population were to get vaccinated and provide proof, there would be a total cost of about $3.8 million. So we are estimating about $1.5 million of those dollars would be ARPA eligible, and that would be for those employees who are newly vaccinated. And then about $2.3 million of those dollars we are looking at an option to pull that from the city's RAMCO budget. Slide. And of course, we would offer exemptions or what we call accommodations. So if there's an employee who, for medical or religious reasons, says that they cannot take the vaccination, they will be eligible for a medical or religious vaccination. Medical exemptions, exemption. Medical reasonable accommodations under the ADA. This is individualized based on an assessment of current medical knowledge that's available. For religious exemptions, we're looking at accommodations under Title VII, which holds, quote, sincerely held religious beliefs, practices, and observances. And so that would go through a full process and review here in the Human Resources Department, walking through the ADA's interactive process. So that's a full life cycle process where you go all the way from the accommodation request to considering accommodations, all the way to implementing and monitoring the accommodation. And so we'll have someone on staff dedicated to do those in that 6-week period, so that when we get over to the 4-week period where we're doing mandatory testing, which we'll talk about in a moment, any employee who has a religious or medical exemption would still be required to get a mandatory test each week. And let's see, I think, yep. And so the last piece of that, if we are providing an exemption, every employee who receives an exemption would be required to sign an exemption affidavit, just certifying that all of the information that they provided to us is true and accurate as of the moment they signed for their exemption. Slide. So after that 6-week period where we're allowing for employees to qualify for the exemption, all employees who remain unvaccinated would be required to submit to mandatory testing for 4 weeks and provide that proof of a negative test before they can return into work. Now, the way that this would work, we're still working on a little bit. There are a few logistical things that we are still having to work out with our partners, both internal and external, but it applies to employees with and without exemptions. The city will pay for the testing on the city's medical plan. This only applies to employees who are on our plan. Any employee that's not on our plan, their healthcare plan would cover when they're going to get the testing. Employees can be tested employees can be tested while they are on the clock, depending on what their status is. Non-exempt employees can be paid overtime if that's needed, and exempt employees may have to test on their own time. It would essentially be up to that department and that department director to decide whether that employee would be eligible for compensatory time if they are having to do their test after hours. We'll accept rapid tests, but we cannot accept any of like the home tests or the home kits that people are using to do tests these days. And with regards to the results, if they're asymptomatic, they can report to work as scheduled as long as they have information that they're awaiting their results. If it's a negative test, they can report to work on their regular schedule. And if it's a positive test or if they're symptomatic, they have to continue following our COVID-19 protocols, which have been in place since last March. And for any employee who remains unvaccinated and refuses to get tested, they would be subject to disciplinary action up to and including termination. The first missed test or the first refusal to test would be a suspension for 1 day without pay, and then that second would be under the policy a termination. It is important to note here that, again, the only thing in this policy that carries with it the force of termination would be a refusal to test or a missed test. Slide. So some other considerations that we've been walking through: newly hired employees would be required to show proof of full vaccination status as a condition of employment. If they are applying for a medical or religious exemption, they would have to walk through the same process that we're doing with all city employees. They would not be eligible for the vaccination incentive, and newly hired is defined as when the policy is implemented. Submitting false records, that is subject to disciplinary action up to and including termination. Following the 6-week period, unvaccinated employees without medical or religious exemptions will not be eligible for promotion under this policy. And the other really important piece that the city manager will do and that staff will do is that we will come back to the committee, will come back to council during that 4-week period to report on what the numbers are looking like, where this is trending, to get further guidance from council on what our next step should be as an organization. And let's see, slide. Okay, and safety is our top priority here. And so one of the things that we know will come out of this policy, there will be grievances that have to be addressed as the policy goes, as the policy continues. And so as those grievances come up, they will be handled at the city manager level in accordance with the city's current grievance policy. Employees will not be able to handle exemptions through the grievance process. If someone wants to be exempted from it, they would have to go through the regular process of getting an exemption, a medical or religious accommodation as an exemption. But we would handle all other grievances that come up as we're anticipating through the regular process. And I'm happy to take any questions.
Thank you, Mr. Barnett. Thank you very much. Councilmember Scipio.
Oh, thank you, Mr. Barnett. Wonderful policy. I love how you presented that. It was pretty clear. My first question is, providing that proof of full vaccination, is that just showing or sending your vaccination card to a particular person within your department or health? Who do you give that to?
Yes, ma'am. So the Human Resources Department does have an employee medical division, and at employee medical, we have HIPAA certified medically trained staff who are prepared to take that information. We are doing some upfitting to some of our medical record keeping systems right now so that we can become a custodian of those records as they come in, so that employees can feel confident that we are keeping and maintaining their information in compliance with all federal and state guidelines.
Okay, thank you much.
Thank you. Councilmember Monday.
Thank you, and Dr. Barnett, thank you for that presentation. I had read through the information that was provided in your presentation, shed some light on some questions I already had, but I still have quite a few. Yes. One is the question that you're going to get from employees who were vaccinated early this year is, what are they getting? And how are you going to address that for people who are already vaccinated before this goes into place?
So employees who are already vaccinated, as long as we have proof, the city manager, we did a paid time off incentive earlier this year. And from that, we yielded 876 employees who are currently vaccinated. So those employees will automatically be eligible for this incentive. So any employee that can show proof of full vaccination status at any point will be eligible for the vaccination incentive.
Okay, so it is retroactive. That's not clear in what I read, but I'm glad for those employees that that's the case.
And we can make that clarification. Thank you for pointing that out.
Absolutely. One of the things that bothers me about the policy is we don't have an end date. It's the way it's written. It's going to go in perpetuity, and I think as the virus changes, we need to have a specific point in time that says we will review and figure out what our next steps are. And I know after the 4-week period, you said we would take a look at things, but the policy to me almost needs an expiration date so we can go back and evaluate it. Also, you spelled out what vaccines are acceptable. A year from now, there may be 2 or 3 more on the market. So I think we need to give this a date.
Thank you for that. And honestly, Councilmember Mundy, I think we would all love to be able to put an end date on it. But I think the reality of where we are right now is that we just don't know how long this is going to go on. One of the numbers that you all will see in some of the other materials you have right now, the estimate for how much it would cost us to do this testing is about $90,600 per week. That number is actually probably going to go up because I just got the numbers for September this morning, and the average COVID test for September is about $86 per test. If I take that same number and I apply that to the number of unvaccinated employees we have today, that's going to cost our plan $144,000 per week. And so what we're attempting to do right now is to really wade our way through this thing. And so that's why we plan to come back to this committee and come back to council during that 4-week period so we can let you all know where we are and seek your guidance as our governing authority to figure out what our next steps should be.
Okay. Thank you. And the other thing I wanted to mention is people who do have an exemption, it said they will have periodic testing. That periodic needs to be defined. I mean, once a year is periodic. So for the safety of our other employees, we need to specify after what period of time they're tested.
Thank you.
Councilmember Clark.
Yes, ma'am. Couple things. First off, with the new hires, it says in there that a new hire were required to either be tested, not tested, either have the vaccination or have a religious or medical exemption. Then on the next one, it says, and if they don't do that, they're not eligible for promotion. It seemed like to me, if that's a condition for employment, the repercussions should be you don't get your job. And so we don't have to worry about it if they're promoted.
And I could be, I've looked at this stuff for so long, it could all be running together for me. With regards to promotion, the promotability piece talks specifically about employees, I'm thinking that are still, that are on staff, and that would also apply to those people. Just the people that are still on staff, and anyone who comes in should be vaccinated. And if they're not vaccinated, I think what that part of the policy is talking about is if they have a medical or religious exemption and they come in unvaccinated, they would not be eligible for promotion. Well,
that's what I'm getting at. It seems like to me the policy should be, if you want a job, you either got to be vaccinated or have a medical or religious exemption. And that's done before you start working. Then the question is, what do we do with the folks that are already here? And what we've said is if you're not vaccinated and do not file for one of those exemptions, then you have to be tested. And if you refuse to be tested after 2 times, you're terminated. So I had a concern about the promotion issue, but it seemed like to me that that should not be an issue because we won't hire anybody that doesn't have one of those 3. And anyone that doesn't have one of those 3 has to be tested. And if they're not tested, they're terminated. So it just seemed like to me we need to clean that up a little bit.
Mr. Clark,
yeah.
When you finish, I'm going to let Mr. Rao chime in when you finish. Okay.
Let me go with the other one. So that's the promotion issue. Anyway, the exemptions, I think we need to be very carefully and have that in writing. What is a qualified exemption? I don't want people to say, well, Joe got exempted for the same reason that I applied for and I didn't get exempted. So we have to be sure we've got that well documented and why it is. The other one you did not mention in here, right now, if you're a non-smoker, you get a discount off your health insurance cost. I would be amenable to a policy where we have upped our charges to employees for what we pay for our medical coverage. And if you've been vaccinated, then you get the vaccination discount. And I think that would be another incentive to get folks to do it, as opposed to penalizing those that don't. I mean, it's a lifestyle question to me, and the smoking is just an example of a lifestyle decision. The last one, and this was brought up to me by someone who called me, and that is the issue of antibody testing. The issue, those who may have had it, and you may have had it and didn't know it, or you may have had it and ended up in the hospital. But if we test someone for antibodies and they have them, my question is, would that then vacate the need to test them weekly? But tied to that is an issue that I have not been able to find any literature on, and that is natural immunity as good as or better than a vaccination immunity? So I think it's a topic worth looking at to see if it's worth that one-time test. Now, that would be a much more expensive test. That I think you got to draw blood versus sticking the Q-tip up your nose. But it might be a way of designating if someone does have the antibodies, and then we don't have to do any testing further. As was mentioned, Mr. Mundy mentioned, this policy only calls for 4 weeks of testing, and I think that's because we're going to probably get an update within those 4 weeks of where we are, but we may be taking this testing on indefinitely, in which case I do think we need to look at the antibody issue. And with that, I will yield my time to Mr. Rao.
Thank you. Mr. Rao.
Thank you, Mayor Pro Tem Adams. Just to respond to a few of the questions. With regard to the frequency of testing, that would be weekly testing for all unvaccinated employees, those with and without exemptions. So to define the term periodic, it would be weekly testing during this 4-week period of time. With regard to the promotability issue, that particular point in the presentation, that applies to existing employees. So going into the 4-week testing period, unvaccinated employees without an exemption would not be eligible for promotion. So that applies to existing employees. As Councilmember Clark noted, with regard to new hires, they have to provide proof of vaccination as a condition of employment or receive or be granted one of the two exemptions. As far as the question about natural immunity, we've done some research, and what we know right now, based on guidance from the CDC, is that there's still a recommendation that even those who have had the virus and have the natural immunity, they still get the vaccination. Thank you.
Thank you.
And I will just add, there are a lot more specifics directly in the policy with regard to the grievance policy and the way that a lot of these things will be handled.
And Mr. Barnett, Dr. Barnett, make sure that you and Mr. Rao, between now and Monday, include as much information as you can in this matrix so the council members understand what this is. Councilmember Scipio.
Yes, I have just two, as we discussed this, a couple of, I just need a little background information. How much was it to do the testing? Did you say $90,000 that we would have to incur for employee testing for 1 month?
Yes, ma'am. It would be $90,600 per week.
Oh, per week?
Yes.
And the way I got to that number, Councilmember Scipio, is we take our full number of employees and we backed out those employees who have proven that they are vaccinated. And so that's just based on getting no more. And at a testing rate of $54, which was the August average of how much COVID tests cost us, which were those were the numbers that we had at the time we submitted. But that number is now $86 per test, and that was for the month of September.
And why is it that we believe we should be paying for the testing of these people when they are not taking the vaccine that's free?
So we would be paying for it on the health insurance plan, and on the health insurance plan, we cannot not test, federally mandated to pay as a health insurance provider.
Okay, great. Good to know that. And who does the determination on the exemption status? Who will be making that determination for employees?
So those recommendations will be made by a member of Human Resources staff. I will certify those recommendations, and the city manager will ultimately determine where those exemptions are made.
And just so you all know, our city attorney and her office will be weighing in on this as well.
Heavily.
To ensure that we don't violate anybody's rights. Just for information, for those that haven't read the matrix, in the city of Durham, they are paying $87,000 a week for 12 weeks of testing. $87,000 a week. Now you got to remember, we don't have the population or the revenue that Durham has, but they're now paying $87,000 per week for 12 weeks. Councilmember Larson.
You're muted.
Thank you, Mayor Pro Tem. A couple quick questions. To be clear, the assumption of the testing cost is based on the assumption that no additional employees will be vaccinated?
That's correct.
Yeah. So really the question I have is, what do we have as far as accessibility to vaccination? I noticed that on the when we hit the 6-week period, after 6 weeks, the 4-week period, I assume, that employees can use their time their service time during the day to go get the test made. Is that correct?
Yes, sir.
With the information. In the front end, we're given vaccinations. How accessible will vaccinations be, and what employees' rights do they have to take time off to get vaccinated? How are we going to expedite the availability of vaccine for the employees?
So unfortunately, we do not have a good way to expedite testing. At this point, we're honestly unsure of if all of the tests that are required will be available. The other thing that we're staring down the face of is the OSHA mandate that we all know is coming. And when that OSHA mandate comes, that all employers with 100 employees or more have their employees submit to regular testing, we're not sure. We have worked with our internal partners and had conversations with our partners at both major healthcare systems that are here, and neither of those systems can commit to providing vaccinations just for city employees.
Yeah. I'm sorry, I'm not clear about that. What I was really asking was the ability to get vaccinated, not tested. But on the front end, during the period of vaccination, what are we doing as a city? Are we giving them time off to people to go get vaccinated? Are we providing a clinic here? What are we actually doing to facilitate getting people vaccinated on our staff?
My apologies for the misunderstanding. So we are permitting employees to basically go during work time in order to be vaccinated.
Okay, so that brings on your page 6, you do have the provision to allow employees will be allowed to get tested on city time as one of your conditions. But then you follow that up with a employee may not be late for work or miss a shift as one of the conditions. So if they're trying to get vaccinated before they come to work, for example, or get tested before they come to work, is that a matter of approval by the supervisor to allow that to happen? In which case, there is a provision. It's not just arbitrary that you cannot be late or you cannot miss a shift. You have to have the approval of your supervisor to allow that to happen.
And my apologies, that should have been clear. Essentially, what we're getting at there is where we're saying to employees that they still have to adhere to all other time and attendance standards even in going to get these tests. And so they can't just walk off the job and come back and say, oh, I went to get my COVID test.
Right.
It'll need to be a conversation, an ongoing dialogue with their chain of command that says, I am leaving work for an approved reason.
Overall, I think it's an excellent policy, and I want to commend staff for putting it together. And I think it's important to execute on it. I really think that we need to facilitate the ability to get the shot or the program, whichever Pfizer or Moderna or whatever, whichever is available, Johnson & Johnson, as quickly as possible. And ideally for our employees on site so they don't actually have to leave the city yard to do this. So whatever has to be done to make that available on a regular schedule would be useful.
Thank you. And I would like to publicly acknowledge Assistant City Attorney Camille French, who did a lot of the heavy lifting on this policy and who will be an invaluable partner as we continue down this road.
Councilmember McIntosh.
So the question that John just asked answered one of my questions, but can we talk about the matrix that we've got here that compares us to other municipalities? I think in the back of everybody's mind is the impact on service levels. And what do we feel like is going to happen from a percentage of employees who are going to say it's not worth it, which is affected by what other municipalities are doing. I think people that leave our fire department or our police department or sanitation, whatever, are going to look for another job in government. And I just want to hear some comparison about how easy it will be to move from Winston-Salem to Durham or Charlotte or something.
Sure. So at this point, all conventional wisdom is out the window. Everything we thought we knew is wrong, and everything is changing by the day, the week. And so in terms of where we are, it's honestly looking like any public servant across the state of North Carolina is going to be held to some standard in terms of either getting vaccinated or getting a test. And so us taking this step is us staying aligned with what our contemporaries are doing. Because I think there is a general thought, and the manager has talked about this several times, a general thought that as a public servant, we do have this responsibility in a lot of ways. And I think that carries across the state with our peers, both our size, larger and smaller.
That aligns with my way of thinking. I just wanted to hear that spelled out. Thank you.
Thank you. One of the things that I would like for Mr. Rao or somebody to go through this matrix that we put together. Most of you know when we start making policy changes, any good business, you're going to benchmark or you're going to go look at someone similar to you. If you would, Mr. Rao.
Yes, ma'am.
Would you go through the vaccination policy comparisons with the other urban cities in North Carolina? And the fact is, I know you all will see that Greensboro has no mandate yet, but I know for a fact, my peers over there, they're working on theirs too, just like us. Go ahead, Mr. Rao.
Yes, ma'am. Mary Beth, could you pull up that particular table?
Because I don't want the public to think, to Councilmember McIntosh's point, I don't want the public to think that we just decided we woke up and did doing this. Our main, to me, as a leader and elected official, again, is to see the big picture and to think of how we keep our employees safe, their families safe, and the citizens and customers of Winston-Salem. All right.
Okay, so this first slide is comparing what we're seeing right now, what the other cities have reported in terms of their vaccination rates. Mary Beth, after I go over this slide, if you would pull up the one that's the policy comparison table, but you can see there right now the post-incentive vaccination rates for the other large cities in the state are right now, significantly higher than what we saw after the offer of the paid time off incentive a couple of months ago. So that is, our goal is to get more in line with those other cities. Greensboro, we don't have the data yet. They did do a survey of their employees. Out of the 3,200 employees they have, 800 responded. And of that 800, 90% reported being vaccinated, but we just didn't consider that to be something that perhaps is representative of the whole organization. That's why we didn't report that. Mary Beth, if you would open up that other table there.
And again, staff will be providing more details, hopefully, between now and Monday, as to things that you mentioned that are not here, but it's somewhat of a timeline. But as Dr. Barnett said, we don't know, just like when we did the incentive for the paid time off, we hoped we would see our numbers go up somewhat, and we didn't. And if you got 34% of your employees vaccinated and they're dealing with the public, we got to do whatever we can do to try to meet that needle. And I've heard all of you say, and over my years, we don't want to be in last place. We don't want to be known as the city that nobody wants to come to because, their employees are not even vaccinated. So go ahead, Mr. Rao, on the comparison policy.
Yes, ma'am. So this table compares the policies of the other large cities in the state based on a number of different elements. So I'm just going to move from left to right. As you can see there, with the exception of Greensboro, the others have policies that are in effect. Of course, we are discussing our policy. So, based on the outcome of next week, we may have a policy that will be in effect at that time. As far as the vaccination incentive, so you can see there that everybody is providing some form of financial incentive. The dollar amounts do vary. Charlotte offers a $250 individual incentive as well as a $250 incentive if the organization reaches a goal of 75%. Durham has a similar dollar amount, as well as Raleigh. Cary offers a similar financial incentive as we are proposing, $1,000. And what we have seen is in Cary, they did see a significant increase in their vaccination rate after they implemented their policy. I think it went from like the low 60% to over 70%. So, so I think part of our thinking, staff's thinking about the dollar amount is, provide a rich, enough incentive that it will motivate behavior. As far as future incentives go, and whether that could be a bonus for getting the booster or whatever, nobody has really thought about that at this point. As far as testing goes for those unvaccinated employees, you can see there that basically everybody is going to be mandatory testing for unvaccinated employees. As far as the cost of testing goes, who bears the cost of the testing? So in our case, we are saying, well, that's the cost share column there, but so I'll skip to that one. So for us, the city would bear that cost. In Raleigh, they are requiring the employee to cover the cost of testing. In Durham, it would be the city. Our thinking on this is in line with federal regulation, that we should be the ones who are covering the cost. And then you can see going back there to the cost of testing column, this is just kind of an estimate. As you mentioned, Mayor Pro Tem Adams, Durham estimates is costing them $87,000 a week, and they're planning to do this for 12 weeks. In our case, it's over $90,000 a week. That's what we're estimating, although as Dr. Barnett noted, we're seeing the cost of the test increase, so it could be well above $100,000 a week. As far as discipline goes, you can see there that basically the cities are going to follow their standard disciplinary policy procedures and consider this insubordination if they don't, if the employees don't comply with the testing requirements. As Dr. Barnett noted, we've have kind of a two-strike policy embedded in the policy. In other words, if you, for the first miss or refusal, an employee would be suspended for 1 day without pay. For a second miss or refusal, it would be termination. And then also, if they submit false records, that would be grounds for disciplinary action up to and including termination. And then finally, the effects on promotability. The only other city that really has provided us any information is Raleigh. And they are also stating in their policy that unvaccinated employees would be ineligible for promotion, which is what we are also proposing as part of this policy, that existing employees who are unvaccinated without one of the exemptions would not be eligible for promotion. So as we continue to have conversations with the other cities and learn more about their policies, and as they make their policies more known, we'll continue to share that information with you all.
Thank you, Mr. Rao. Councilmember Monday.
Thank you, Mr. Rao. A couple of things. When we look at this comparison next time, I wonder if we could see insurance costs. I've been told, and I can neither confirm or deny this because I've not seen, what do our employees pay for their insurance now versus other cities? And I want to know how we compare, so that if we do have to take that rate up for not being vaccinated, what that's actually doing in comparison to the other cities. Yes, and the other thing I just wanted to clarify on an expiration date, it's not my assumption that we can predict when the virus is going to be gone, but I'm saying we need a date in this policy that says we will review at this time to determine if we need to make changes. Otherwise, we end up with a policy that's in place without a need to be there.
Thank you. And they will. Again, they're going to add all of this and they're going to get it to everybody. First of all, I apologize. Protocol, the mayor is on the meeting. Welcome, Mayor Jones. And the city manager wants to chime in. Mr. Garrett.
Good afternoon, Mayor Pro Tem Adams, members of the City Council. We will make those revisions. Councilor Monday, we can put a date certain when we'll bring it back to council. I have almost biweekly conversations with all the other cities that are on this matrix with their managers. we're all in agreement of where we're going with these policies to try to ensure that we protect our workplace. That's really important to all of us. It's hard to know, all of us we talk about, it's hard to know, where we will be. We need to wait and see how well the incentive works and how many employees decide that it's a burden to be tested every week. There's no question about it. Even with the city paying for it, which is, I think, the appropriate thing to do based on the regulations, it's still an inconvenience. So how many employees decide to get vaccinated between those two things? At that point, then we want to come back and talk to you all about options. I've heard from employees who want us to say now what those options will or will not be. You just don't know. And you really want to be able to look at it, yes, and look at service levels. What is the impact if some employees leave the workplace? What will that do to our services, which is critical to our citizens? So we just don't know until we come back. And one last thing I would add, Mayor Pro Tem, is the promotion piece. Obviously, council can change that. It's my recommendation, though, that if you want to be a leader in a public service organization, you need to get vaccinated and do the right thing. And that's where that's coming from. And my colleagues in other cities agree with that as well. Thank you.
Thank you, Mr. Garrity. Councilmember Clark.
Thank you, ma'am. Just real quick, I think we need to be careful on the testing requirement until we have the kits. And from what I read, and this was mentioned earlier, we may not be able to acquire them. I think we have to be careful until we have kits in hand to test before we could require it. I can see people saying, well, I went to get tested and they didn't have any kits. So does that qualify for the week, or does it qualify as this or that? So I think we require someone to get tested, we better darn sure have the testing kits. Number two, your 34% is inconsistent with the graphs you showed on where we're getting the money from. You showed 2/3 of the cost coming from Ramco and 1/3 from the ARPA. The Ramco money would pay for the folks who have already been tested, and if it's 34%, it wouldn't be 2/3; it would be 1/3. Having said that, I would be very suspect of that number. I can't believe our number would be that far off than all the other cities. Our number is based on self-reporting and our people that signed up for what it was, 5 days vacation or wherever it may be. I think we'll have a much better feel when it's implemented and people say, here's my card, I've been tested. So I think it would be very interesting to see how those numbers look a couple weeks into it. Thank you.
Thank you. And Councilmember Clark, that's what we've been hoping for. And yeah. We're in a position right now that, as Mr. Garrity said, along with our peer cities, as leaders, we're all faced with the same situation. How do we get our employees to buy into this without the feds, OSHA, mandating it when it does? That the numbers that we have, and when I've been meeting with the city manager, we always discuss these numbers. And to not see our numbers move, like you said, maybe people don't want to share the information, peer pressure, don't want their peers to know they got it, because they talking smack at the job, I'm not doing it. But at the end of the day, even to Councilmember Mundy and others about the cost, we'll bear the cost of the testing and the coverage. We got that because there's a little help out there now. With the feds, the ARPA money, as well as the COVID and everything else. But we've got to move our needles. That 800 to 900 number has not moved in months. We got to move the needle. And it's not just us wanting this done. You got to remember, again, who we serve. We serve the citizens of Winston-Salem. You got employees that want to come back to work but are afraid to come back to work, and therefore they won't come back. They'll stay at home and want to work offline. Dr. Barnett.
Thank you, Mayor Pro Tem. I just wanted to clarify, we as an organization will not be providing incentives. We won't actually be purchasing vaccinations. We won't be purchasing vaccination kits. We are paying for them through our healthcare reserve fund when people go to be tested.
Well, that's my point. We got to provide a way for them to be tested very easily if we're going to fire them if they don't get it done. And to me, that means either we got to pay for Safe Hospital to have somebody sitting at City Hall that'll do it, or sitting somewhere, or have an agreement with somebody that'll guarantee we can test. But if somebody goes to be tested on Monday and there's no kits, how many places are they supposed to go to before they qualify for being tested? I had a child who thought he had it. He drove to every CVS in Charleston County, and not a single one had a testing kit. But the point being, we can't require something unless we can be assured that it is 100% readily available. That's my point.
And Councilmember Clark, your point is well taken. I'm sure Dr. Barnett and Mr. Rao and Mr. Garrity, again, working and collaborating and talking with the other city managers. How have they been doing it, the ones that have initiated their policies before us? It may be that we will follow what they're doing in order to make that happen. As everyone knows that when the shots first came out, we knew all how scarce that was. People were running, couldn't get it. And then when they released it, well, all of us could get it. Then they had an overabundance, and the country started shipping them to other countries. I'm sure that staff will look into how we are to engage in that process to ensure that employees are equally treated in how the process goes. And the dates and timelines, just like this virus, will change. Again, we don't know from one day to the other, like you said, Councilmember Clark, whether we're going to be able to do any of this if we don't have the kits, if there's no shots. But we're going to figure it out, because we may offer one piece of it and can't offer the other piece yet. It may go like that, but we got to figure it out. I hope we spoke to this enough, because we do have 3 more items. What is the pleasure of this committee?
I'll move approval.
Thank you. I have a first. I have a motion. Do I have a second?
I would move approval with revisions.
Excuse me?
I would move approval, but with revisions, some of the revisions that we've talked about.
Okay, Councilmember Clark, are you okay with that?
No, I'm going to withdraw my motion. I'm going to make a motion that we send it forward with no recommendation, because I think there's just so many answered questions that I think could be answered between now and next Monday night, but we need to vote on it Monday.
I would second that.
I will move, we move it forward to general council.
Seconded that we move the agenda item G1 to council without any recommendation. All those in favor, let it be known by saying aye. Excuse me, city clerk, roll call vote. I'm running another meeting. It's not even city. Go ahead.
Councilmember Scipio.
Yes.
Councilmember Mundy.
Aye.
Councilmember Clark.
Aye.
Mayor Pro Tem Adams.
Yes. Thank you all very much. It passes, and G1 will go to council without any recommendation. Please call the next item.
Item G2, 2020-2021 Human Relations Commission's Annual Report.
Ms. Tony?
Yes, thank you, Mayor Pro Tem Adams and members of the committee again. This item is the Human Relations Commission's annual report. They provide this report annually. This commission has been in existence since 1978 with a very simple vision that Winston-Salem is a place where everyone is treated fairly. And they have been ensuring that vision over these years. And so I would like to recognize Dr. Wanda Allen Abraha. She is the director of the newly merged department called Human Relations and Diversity, Equity, and Inclusion to review highlights from the report and recognize any commission members who are present.
Thank you.
Thank you. Thank you, Assistant City Manager Tony. And good afternoon, Mayor Pro Tem Adams and members of the City Council. Yes, I'm Alan Abraham, excited to be here to present the annual report for the Human Relations Commission. Of course, this is reflective of last fiscal year, so all of the items that will be referenced during this presentation will certainly reflect only on the work of human relations during that time period. And we're fortunate today to have our Vice Chair of the Human Relations Commission, Ms. Carrie Wiggins, and we also have one of our newer yet more active commissioners, Commissioner Melissa Thompson. They will be co-presenting today in the absence of Chairperson Robert Leake, who was unable to join us today due to a personal matter. So I'll turn this over now to Vice Chair Carrie Wiggins.
Good afternoon, and thank you, Dr. Wanda Abraham. And it is a pleasure to be here to share with you all the efforts that we are extending in spite of this pandemic to make sure that we are serving the residents of our community. So I'm going to start with one of the events that is always usually a really big hit for us when we were in person, but it has served us well doing it virtual. And that is the 41st Virtual Human Relations Student Awards Banquet. And this is a format that we put on virtual this year where we highlight and celebrate students across this county that have taken it upon themselves to invest in the community at an early age. They provide services, whether it is going to a nursing home, whether it's teaching someone to read, whether it's doing a clothes closet, whatever it is, whether it's saving an animal. And so we have children across our community that we are still encouraging to be active and vigilant in the community. This virtual presentation was aired on the Winston-Salem TV channel 13, and it can still be viewed on YouTube. The next event that we conducted again on last year that was virtual was the International Village. And again, we have been able, in spite of the pandemic, to transition these events from in-person to virtual and still be successful. And this was another event that was successful. It was presented in September and showcased our community's international population via food, dance, arts and crafts. The marketing communications department helped us produce a 60-minute program, and it highlighted past performers, new videos, and vendors. The next event that we conducted virtual was the High School Student Relations Forum. This again was very well attended and supported in person, but it has the same momentum as it would if doing it virtual. And so we have the forum was held virtually on the city's YouTube channel. Students from the Winston-Salem Forsyth County Public Schools participated in the panel discussion, and it was also moderated by two of our youth. I'm so sorry, I drew a blank, but it was moderated by individuals that serve on our youth advisory. And these forums continue to inspire us and share with us just where our students are, what is on their minds, and how we as a community can make things better for them. The Human Relations also partnered with the Winston-Salem Police Department and conducted our Trust Talks. As you know, our Trust Talks, again, were held face-to-face, but virtually we still been able to provide and share information. And so we worked with the police department to initiate a community relations outreach entitled Trust Talks. And the 2020 Trust Talks event was held virtually and focused on the neighborhood associations. Now, Commissioner Melissa Thompson will share with the rest what the committee has done this past year.
Hello, it's good to be here with you today. One of the main points that we want to talk about is really that with the pandemic, nor the virtual platform has hampered us from doing the work of the department or the commission. One of the initiatives that was created was an eviction diversion network, EDN, which was created in response to the heightened eviction crisis. Chairperson Leak attends these meetings on behalf of the Human Relations Commission. A smaller coalition of landlord-tenant focus group that held a few meetings prior to the past summer was already established. The Eviction Diversion Network is comprised of that original core group plus many more organizations and is eviction specific. The program focused on addressing eviction diversion in 3 different ways: through the development of the eviction diversion educational packet, which provides housing, financial assistance, food, and other resources in both Spanish and English for landlords, homeowners, and tenants. This information is available on the website, and hard copies are available through various EDN partners. The Winston-Salem Human Relations Department, Wake Forest University School of Law, and Legal Aid have partnered to offer the free eviction diversion mediation program for eviction-based matters. And a right to counsel program was created that will provide free legal counsel to tenants who qualify. And then the most recent initiative that we have stepped into is the establishment of the NDO study subcommittee. So that was created this year in response to the NDO ordinance that was passed, and in getting prepared for the city to meet the criteria of the NDO ordinance. The charge of the subcommittee is to advise the HRC and City Council on critical issues facing the LGBTQIA+ community. It's to recommend policies and procedures that advance social and economic equality for LGBTQIA+. It hosts public engagement opportunities such as town halls and forums to support efforts of the LGBTQIA community through coalition building, and to provide a report to the HRC and City Council at the end. We've been given about 18 months to conduct this subcommittee. The Human Relations Commission worked really diligently with the intention to make sure we had a diverse group, selecting 7 core members with 2 alternates for the 18-month commitment. We had our first NDO subcommittee meeting in August, and during that meeting, we identified 5 focus groups that include housing, economic mobility, outreach and visibility, city facilities, and social services. So our focus groups are currently researching what services, training, awareness, and tools already exist, and determining areas for opportunity to better train and equip local businesses, social service agencies, shelters, and facilities for the start of the NDO ordinance in January. The subcommittee meets monthly, and focus groups meet as needed to prepare our reports so that we'll be ready for the City Council with some actions and recommendations to direct.
And there's one other, Commissioner Thompson, I'm sorry, were you complete?
No, you go ahead. Go ahead.
All right, thank you. There was one other effort that the commission is extending as well, and I think the committee already has a copy of the Nexus and two Communicado newsletter that we produce as well, just highlighting what is taking place within those conspired efforts together. And I think with the committee working along with the department during this virtual era, it has given us a greater opportunity to look at how we can reach and expand the work that we're doing. And at first we thought it was going to be an extreme challenge for us as well as everyone else, but we have really been able to continuously serve the residents of this community, working along with the department and also with our new assistant city manager. We have been able to really dig our heels in and complete some really great work with the NDO coming on board with the commission, and just the changes that the department has taken on. It shows us that we are still doing some viable work in this era, and it is a privilege and a pleasure for me to be able to serve on this committee, on this commission, to be able to serve the residents of Winston-Salem and to work to support the work that you are doing as well. So thank you for the opportunity. And does anyone have any questions of Commissioner Thompson or myself?
Any questions or comments? I want to thank you, also Chair Leak. And thank you, Vice Chair Wiggins, and thank you, Ms. Thompson. Thank you, Dr. Abraha. Thank you, Ms. Tony. Thanks to everybody for this important work that you're doing. Councilman McIntosh, are you waving or raising?
Both. So I don't have a question, I just have a comment. I've worked closely with the group through my association with the realtors, and I really appreciate everything that y'all bring to the table. It's been a really tough stretch, and having such an active commission and an active department really, I think, has helped people weather the storm. And I appreciate all the efforts that have gone into it. I really can't wait till we get back in person to do the International Village. I really miss that.
Yeah.
Let's get back to doing that as quickly as we can.
Thank you. Again, thank you all so much for the important work that you do. You are a vital part of the city of Winston-Salem and who we are. All the different threads that make us who we are, colors, length, textures, fibers. Thank you so much.
Thank you.
Thank you. City Clerk, next item, please.
Item C3 or G3, Office of Sustainability Reports.
Mr. Taylor.
Afternoon again. I'm going to transfer this to Ms. Helen Plowski, Director of Sustainability.
Welcome, Ms. Plowski.
Thank you, and good afternoon, Mayor Pro Tem and members of our committee and city council. Just a brief introduction to this item. I know there are a lot of reports attached to this, but I will first turn it over to our chairperson of our Community Sustainability Program Committee to review a few of the highlights from that group in the last fiscal year. And then once she does her review, I will once again take over to speak more to the other two reports for our Office of Sustainability work. So with that, I will introduce our chair, Ms. Sarah Pesic.
Hello, everyone. Thank you for having me, Mayor Pro Tem Adams, council members, and other members of the committee. So I just want to do a really high-level overview of the work we've done this year, and I'm cognizant of the time, so I'm not going to get into the weeds, but you can see in that document.
Well, excuse me, you got 15 minutes because we're going to, we're going to hold item G4 until next month so we can get through this report. Okay?
Wonderful.
Go ahead.
Thank you. You know, we have all been impacted by COVID, and we know all the ways that it has derailed plans. But one thing I wanted to mention too is that the opportunity to meet virtually actually, I feel, has increased the attendance at our meetings too, because people who have to get off work at 5 and then drive downtown and everything, I feel like it actually made it a little bit more accessible having this as not only a requirement during COVID, but also as an option. So I just thought I'd air that because there's a number of people who were able to participate in a way that they couldn't before. I broke down the report into some key areas that are based on the subcommittees. Our subcommittees are ad hoc, so we expect there maybe new ones will pop up this year, and maybe some of these will be dissolved. But the larger areas are tree cover, transportation, environmental justice and green jobs, and recycling. I did make a note at the top of the document that one of the things that was accomplished this year was the resolution that you yourselves, the City Council, approved last November, supporting 100% clean and renewable energy by 2050. We also had included language about creation of green jobs in that resolution as well. So I'll just, for a general overview of the tree cover subcommittee, we happen to have a few key experts in our group this year who have a lot of expertise in tree cover and native plantings and such. And so what they spent time doing was really to kind of look at, and I should also preface that these are not necessarily anything that is being recommended to the city council, but these are the areas that we within the subcommittee would like to dig down further into. And some of those things, those items related to the tree canopy plan or the adopting a no net loss policy, meaning no net loss of tree cover. There were some things that came up related to the inconsistency in tree cover in different parts of town, how some parts of town don't have as much plantings. And so representatives in our group from the different wards expressed that they'd really like to have some more focus on plantings to not only decrease the heat island effect, but to beautify those neighborhoods and the right-of-ways there. There's interest in the subcommittee to actually hopefully use some students maybe at one of the local colleges or universities to have a class project. We have a couple faculty members that are interested in this, having students actually use GIS to create a database of forested areas, which we think would be really beneficial for probably a couple different departments within the city. Then for the transportation subcommittee, one of the key things that was that I heard from Helen and some of the subcommittee members was it might be really interesting to look into electric vehicle ordinances and policies at a city level, because we anticipate as money is coming through from the federal government down to the state and local government, we hopefully will get a lot of new electric vehicle charging stations, but we also want to look 5-10 years down the road so that we don't end up in a situation where we hadn't thought through kind of the policy side of that. So that is something that we'd really like to look into, and also consider some of the spatial justice issues around like where are those charging stations located. Related to environmental justice and green jobs, there's a number of people on the subcommittee that in their personal and professional life are already doing some work around this. What we hope to do is really focus on the partnerships. So not necessarily creating any new work for the city staff, but really making sure that those folks who are in nonprofits, universities, colleges, or just have their own little group of friends in a neighborhood, like how can we all make sure that we're connected and supporting each other? And then maybe as that is happening at a larger scale and across different neighborhoods and different wards, then we can be set up for when some of those funding opportunities arise, that we already have that network of relationships and have built trust, so we can maybe go after some larger funding opportunities. And again, I don't even mean like us as a subcommittee, I'm saying generally for citizens in town and organizations that will be set up and supported and be able to take advantage of the opportunities. And then the last subcommittee, which is a little bit shorter, we heard loud and clear from both Johnny and Helen that there are some challenges with recycling, which is really largely about the citizen, the individual recycler. People want to recycle more than we actually can recycle. And then we create a problem we create a problem in the MRFs or the recycling facilities. And so we have spent some time trying to brainstorm how we can help Helen as she's rolling out these different social media campaigns. So we're still trying to wrap our head around it, but we know that it's an issue because we've heard it from city employees and from citizens saying, we really want to recycle these things. Why can't we? Well, that needs to be clarified for individuals as well. So that is just a brief overview. And I don't know if you would like to take questions now or if Helen is going to present another piece of her department's work.
I'm going to go ahead and let Ms. Poplawski go ahead and present.
Great. Thank you so much, Sarah. And thank you again, Mayor Pro Tem and the members of the committee and city council. I will now get into just some brief highlights of our annual local government sustainability report, as well as our newly completed community level greenhouse gas emissions study. So I'm going to start with our local government report. And just start with highlighting some of our greenhouse gas emissions data that we have. And this is from calendar year 2020, which was an interesting year, of course. And so what we saw was a definite impact of our local government operations emissions. We actually reduced 5.7% of these emissions from 2019 for a total of 146,400 or so total emissions. A lot of this just was a result of the reduced use of a lot of our city buildings and facilities, especially in the electricity use category. So that's where we saw a lot of that reduction. I will also point out, just because it's been a question in the past, just highlighting again some cost savings that we've seen. So you know, we talk about energy efficiency efforts and LED installations. And just since 2018, between 2018 and 2020, from streetlights and our parking, our DOT parking upgrades alone have saved the city $676,000. So that's a really encouraging number to highlight. And just again, the importance of noting that is, you know, when we look at the next step. So energy efficiency is one step, but we now have funding for renewable energy systems, specifically solar. And if we put that solar on a facility that has already implemented some of these energy efficient upgrades, we won't need as much solar to cover the energy needs of that facility. So we're saving money both in that energy use up front from the LEDs, but also saving some energy or saving some money that may have been needed to put a bigger system, for instance, on a facility. And then just some other information included in this, the recycling piece of our Office of Sustainability, we saw, as may be expected, that after March of 2020, when the pandemic began and people shifted more to working at home, that there was higher tonnage in each month during the pandemic when compared to 2019 tonnage. So we definitely saw a significant increase from that. And then some other news that I would love to highlight, our Keep Winston-Salem Beautiful programs had the highest sign-up numbers that has ever been seen from that program in the 20 plus years of its existence. And so that puts us right now at, well, at the end of the fiscal year, 175 total adopted locations between our streets, parks, and streams. And we are seeing that trend continue. So there is still continued interest in these programs from our residents. And so that's some great news that I would love to highlight there. And now I'm going to shift into another high level review of our community level greenhouse gas report. So this is, I would say, an unofficial report because this was just based on data that was available, and that's mentioned in the report itself. So it does not include industrial emissions in our city. It also does not take into account any kind of carbon sinks. So anything that the trees might be absorbing to reduce those emissions, for instance. But based on what we do have, which is the residential sector, commercial sector, and industrial, we saw about 3.4 million, that's metric tons of CO2, meaning that our local government emissions actually account for about 4% of our total community-wide emissions. But we also saw some really interesting data come again from what we saw in 2020. Because of the reduced emissions, I would particularly like to draw attention to the reduced transportation emissions. So there was a large decrease in our transportation emissions from 2019 to 2020, and at the same time, an increase in our number of good air quality days, which when you calculate that correlation, that is an almost perfect negative correlation, which just means that it's almost certain that if we reduce our transportation emissions, we will increase our good air quality days locally. So that was some pretty significant data that we got thanks to the difference that we saw in 2020. So, you know, that's again, just high level of both of these reports, really touching more on the emissions than I think we have in the past. But I'm happy to take any questions now. Sarah is also open for questions regarding her report, but thank you.
Thank you. Councilmember McIntosh.
Yeah, I want to thank Sarah and Helen both. You know, they brought up some issues that are near and dear to my heart. A couple things that we're going to deal with actually in Public Works. We're looking at our memorial tree planting policy, and I'd like to shift our approach to that to get away from sort of the street ornamental trees and try to get into some canopy trees. There are definitely parts of town that look prettier than others when it comes to canopy, and I think that's a relatively inexpensive way to achieve some parity amongst how our neighborhoods appear. To that vein, I came across an app years ago called iTree Canopy, and so what Sarah was talking about, a lot of that, there's a lot of data out there, a lot of work that's been done. So you know, rather than reinvent the wheel, I think we can use those to our advantage really well. The recycling issues resonate with me. I get lots of calls about people wanting to increase it, but we have that critical question of, are we really doing any good if we're picking up more recycling off the street and then putting it in the landfill because there's not a market for it? So that's a really difficult one to sort of work our way through. And then just predicting where and what kind of charging stations we're going to need for the electric vehicle situation that's coming at us. We're going to have a tremendous shift. It's already happening, but it's going to happen quicker over the next couple of years. We're going electric cars, no doubt about it. The question is going to be whether you're going to be able to plug that car into a 110 outlet, or if you're going to need a special connection. Right now, Tesla sort of has everybody else boxed out on that. I think that will change. So I don't want to see us make an investment that's going to turn around and be wasting money down the road. So I think we kind of have to play that one by ear. But I do also really like Sarah's comment about having shovel-ready stuff. So when money comes down the pike, if we've got programs that we know can work and save us money, and we can get some federal aid for it, we need to be ready to accept those. Thank you.
Thank you. Councilmember Clark.
Yeah, I have one question and then some comments. If you will look at page 9 of your report, the second paragraph, it reads, and I quote, "To maintain consistency with previous reports, calculations assume 2.1 pounds of CO2 emitted per kilowatt consumed." And then it goes on to say how it has changed over the years. So my question is, on your electrical usage, what you're having to do is convert kilowatts to pounds of carbon. Do you adjust the numbers each year as Duke improves their efficiencies?
Yes, our energy manager calculates those numbers with different multipliers. So we have that data depending on what we want to use it for. So in these reports, and the sentence that you state says it perfectly, we're just trying to keep some consistency so we can compare our own emissions from when we started. So that's why we use that multiplier and that number in this report, but we do have that data in case we wanted to use it in another way.
Yeah, anyway, my point for that is 82% of our CO2 tonnage came from electricity. And there's two ways we can reduce that. Either we can use less electricity, or Duke Power can use less carbon to make the electricity. Point number 2, there's a difference between renewable energy and carbon-free energy. Duke Power probably leads the country among, I know they do, among major utilities as far as the amount of electricity that is non-carbon produced is 63%. That's because they have a unusual large number of nuclear plants.
Yeah.
For me, I am more concerned about CO2 emissions than I am renewable. I do know for some people they do not count nuclear energy as renewable, but I think we need to be sure we report the CO2 effect, because I personally feel like modern nuclear power plants are going to be part of the answer. Okay, anyway, moving on. Charging stations, this kind of goes on the piggy bank of what Mr. McIntosh was saying. Neither you nor President Biden needs to worry about charging stations. The free market will provide them in abundance. Duke Energy makes money every time you plug a car in. They will have a contract within the next 10 years, and there'll be a Duke Energy charging station to every Mickey D's in the Southeast, and they'll be at all the hotels. The people I know who have electric cars charge them at night at their home. If we wanted to do anything there, it might be helping to provide a kit. And as Mr. McIntosh is, we're not sure what that kit looks like yet. But the folks I know that have it plug their cars in at night, and therefore they don't need a charging station downtown or at Haynes Mall or whatever. Where they need them is when they drive to Myrtle Beach, they need one halfway down at some McDonald's or Exxon station on the interstate. And I can assure you, Duke Energy will go out of their way to have them there. And I would recommend you meet with Jimmy Flife. He's the Duke representative, and I think y'all can learn a lot there. I ask this every year, and I never get it. Is there a way, and do the numbers make sense, to further incentivize Duke Energy to accelerate the replacement with LED lighting? Can we write them a check and they do more of them quicker? Because that's certainly a benefit. The last one, I'm going to give you a challenge. There's a home run out there, and if you can hit it, we can help the whole country. Every sewer plant in this country, and they got to be thousands of them, have a problem with the sludge that comes out at the end. We dry ours with natural gas so that we can sell it, we pelletize it and sell it as fertilizer, I guess. That is 62% of the total natural gas usage of this city. We need to come up with another way to dispose of that sludge other than drying it. It's still going to rot, and it's going to give off methane gas when it rots, but do we have to dry it to begin with? I don't have the answer. The reason we went to the drying is because we used to put it on certain agricultural fields, and there weren't as many of those fields available. I'm not a farmer, so I don't understand that. But everybody in the country, there's 1,000 utility managers out there that have this problem. There's got to be a better answer than burning all that gas to dry this stuff out. And if we got to go buy an 80-acre tobacco farm and do nothing, and then buy a plow and plant soybeans and spread it on it every year or every month, whatever we got to do. But I would challenge you. I think that is something that the sustainability group nationwide needs to look at as to what's a better answer than that. So that and the street lights, I think, are two areas that we can grab it. I do like Mr. McIntosh's thing on planting. I used to complain they would plant the crepe myrtles on the street, wouldn't do anything with them, and instead of getting a nice tree, you got a little scrawny scrub because they have to be trimmed. We finally got out of that, but I do think looking at more canopy trees would make a difference. And my last comment in this, and this may get captured in your number of good days versus bad days. Do we systematically measure our carbon levels? That's one thing that can be measured precisely. Now, I know I got a net at my desk here. If you measure it near a 5 points intersection, you're going to get a different reading than if you measure it in a neighborhood. But it would be nice, or maybe just to publish the number of good days versus bad days. But that would be good information. But anyway, very good report, and I'm challenging you on the sludge. Thank you.
Thank you, Councilmember Clark. Councilmember Scipio? You're on mute. What's going on? No.
Finger's not working.
You're good.
Thank you. I always find these reports just so informative, and I thank you, the department, for providing them, because I think we don't always think about how do we maximize taking care of the environment for the future. So I do thank you for all of the reporting and helping us think about what we must be doing now so that we will have a positive future. One of the good things that we did that you may or may not know about is in the renovation of Winston Lake Park, where we have dredged the lake. That sludge was transported up through a tube to the golf course to the driving range. And so we're, instead of hauling it off somewhere to be dumped, it was repurposed, and we're also now having a better driving range that it's being created. And that's the kind of thoughtfulness we must have throughout the city in the things that we do and how we build and construct going forward. So I thank you very much for very, very good information and these good reports.
Thank you. Any more comments or questions for the committee? Again, we want to thank the Sustainability Commission, Helen and Sarah. I mean, you guys are really doing the heavy lift, especially in the times we live in. And when you talked about the recycling and the landfill, we know, everybody knows what happened last year across the country. You had more people at home, more people eating, snacking, and creating, hopefully, recyclable stuff. But I want to thank you for the report. I'm looking forward to working collaboratively with the tree canopy, Councilmember McIntosh and Clark and others. I'm looking forward to us figuring out how we can keep our emissions down. Again, something else we found out, when people aren't moving in automobiles, it's automatic. So we know it works. So I'm looking forward to seeing out of Public Works and others what we can do to try, if not to continue the trend, but at least stay as close to it as we can as we move to better improve our environment. So any last comments you want to make, Helen?
Not at this time, but thank you very much for all of the feedback. I appreciate it.
You are welcome. If there is no other concerns or questions, so order of business has been satisfied. Public Works will be at 6:15 p.m. Is that correct, Chair McIntosh?
Let's do 6:20 so I have time to get downstairs.
Okay, 6:20 p.m. If everything's good, this meeting is adjourned.